Where do you think the next breakthrough drug for MSers will come from?
Breakthrough drugs. So, I mean, we've got a large number of drugs now, and what we do know now is the best results are with the most effective therapies. But the most effective therapies come with risks. As you know, with tisabri and natalizumab, it's that infection of the brain called PML. With alemtuzumab or Lemtrada, the risks are secondary autoimmunity. So the next breakthrough really is going to be drugs that are as effective as those without risks. So I think the next breakthrough is going to be a very effective anti-inflammatory drug that's safer to use, which means many more people will want to use it earlier and earlier in the disease because it's safe. So that's, to me, the breakthrough, is a safe anti-inflammatory. Then in progressive MS, we need to now think about how do we, because all the anti-inflammatory therapies haven't really worked in progressive MS yet.
Yeah.
So what we probably need to do is combination, is add on a drug, what we call neuroprotective therapy. And I think the next breakthrough is going to be a combination for progressive MS. We'll have an anti-inflammatory plus something else to slow down the progression of the disease. I say slow down because I don't want to raise people's expectation and say we're going to stop the progression. But I think even if we slow down the progression, it'll make a big difference to people's lives.
Okay, that leads on quite well to the next question, which is why don't the newest tranche of disease-modifying drugs work for secondary progressive MS or PPMS?
So why don't they work for well, I think that's the way we define the disease. So my personal opinion is progressive MS doesn't just pop up at some point in time. It's there from the very beginning. And I think what underlies progressive MS is this progressive brain atrophy, this shrinkage of the brain, this volume loss. And if you look at studies, this brain volume loss is occurring from the very earliest stages of the disease, from the first clinical attack or even before. People before their first clinical attack have got brain volume loss. So by the time you prevent with progressive MS, you've already lost a large number of neurons in that particular pathway. So trying to protect the pathway when it's lost most of its neurons is very difficult. So I actually think we need to go back and start treating early disease with drugs that protect the brain to prevent progressive disease. So I think the reason why these drugs haven't worked is because we're trying them too late in the course of the illness. We should try them earlier. Or we need to use different strategies. So anti-inflammatory strategies on their own are not effective. We have to add in what's the combination strategy. So I'm quite confident, and I'm confident that when we start thinking about combination therapies, we'll start to have an impact on progressive MS.